The day of the operation, the patient arrives into the pre-op area, and the patient will be evaluated by the surgeon and also evaluated by a nurse and evaluated by an anesthesiologist. And all questions are answered, and the procedure is reviewed if the patient has any further questions. Then the patient is taken into the operating room, and the patient will be put to sleep, and they will be asleep during the operation. The majority of the time, the patient is asleep under a general anesthetic. At times, we do these also under local, where we numb up the groins and the patient is not asleep. That is dependent upon the patient's condition. Once we're in the operating room and anesthesia has the patient comfortable, we will make sure that both of the groins are clean and make sure that there is no evidence of infection, and then we will prep out the groins and get everything ready for the operation. Everything is done under a sterile environment, and then we will use an ultrasound to look at the groins, look at the blood vessel, and then we essentially put a large IV into each of the groins, and it's through this large IV that the graft will be delivered. There are many different grafts that are available on the market, and the doctor will look at the aneurysm and pick a graft that will best fit that patient's anatomy. And once a graft has been selected according to the size of the aneurysm, that graft will be introduced through the blood vessels in the groin called the femoral artery, and through the femoral artery, the graft is advanced into the abdominal area into the aorta. And this is all done under X-ray so we can see where everything is going. And then we take pictures called an angiogram, where we shoot dye through the blood vessels. We mark where the aneurysm is present, and then the graft will be opened up by pulling a wire or by unsheathing the graft, and it will open up underneath the renal arteries. We then introduce a balloon to balloon the graft open so that it will stay in place. So the majority of these aneurysms are below the renal arteries, or it's called an infrarenal abdominal aortic aneurysm. After the operation is complete and we do an angiogram and we make sure that the graft is in a good position, we make sure that there's not blood flow into the aneurysm any longer, we take everything out of the groin and we make sure that there's no bleeding from the groin. And we make sure that there's good blood flow to the legs.